we have some news in terms of what's going on with my MS. As you know, I've been off my medication now for, I think it's coming up to 10 weeks. And of course, I have started having an MS relapse, which is exactly what I thought would happen. I'm having something called optic neuritis. Weird flashes of light. I'm losing vision in just little patches. Optical nerve is currently being attacked by your immune system. I recognized it straight away. I had pain moving my eyeball because it's inflamed. So yeah, it's gonna, it hurts. Obviously told the neurology team at the hospital, and they need me to start a very high dose of steroids for 3 days. My neurologist decided that I should change my treatment plan to something a little bit of a more aggressive medication, as my MS has progressed in the years, not by relapse, but just general progression. You know, I have something called foot drop, and that's where I'm walking and my foot can just drag and I can trip and fall. And I had it in one leg, and then in the last year it started happening in the left leg. They asked me to stop taking my medication, which is fingolimod, Gilenya. I have been on that for the last 10 years and everything's been dandy. I've had no relapses. It's great. It's just a pill. I loved it. It's done. So then we had to leave me off it for a month and then do my bloods. My bloods came back. My lymphocytes are better. The MS nurses called me and told me that, hey, we've got 2 drugs that the neurologist is recommending you start. They have more efficacy or more aggressive MS. I'm now doing my research. Next week, myself and my wife are going to go to an appointment to have some education on the drugs, and I have to come to a decision on which drug to take. Now, both drugs, one is a pill and one is an injection. Yeah, coffee. So the first one is Mavenclad. You take 5 pills for 5 consecutive days in month 1, and then in month 2 you do the same thing. You don't have to do anything until the next year, where you will do the same treatment, and then you may not ever have to take it again. Then the second course of treatment will be 12 months later. Same thing. 5 pills for 1 month, 5 pills month 2, and then wait 12 months. During treatment, you will need to have bloods every 3 months just to make sure your lymphocytes are at the right level. I was doing exactly this on Gilenya and for 10 years, and it was fine, and then it wasn't fine. So here we are. So this is a drug that is a subcutaneous injection under the skin. Basically, Kesimpta targets the B cells, so it's not using the lymphocytes to lower your immune system. It's just going straight for the B cells. Those are the 2 options I've been given by the neurologist, and I have to kind of go away and think about it. For me, I would be more inclined to go with the Kesimpta, just because it's actually working in a different way to the last drug I was on, and I like that. A once a month injection really isn't the end of the world. So let's talk about side effects of these medications. So with Mavenclad, most of the side effects are very similar to what the Gilenya was doing with the lowering your immune system, so it's not attacking you, which could cause rashes or viral infection, hair thinning. The Kesimpta, it's upper respiratory infections, UTIs, the herpes virus. I've never had the herpes virus. I don't know if that means it's going to give me the herpes virus or just make me get the herpes virus. But I think what's worse is losing the ability to walk or use a limb, or like MS is worse. I'll take herpes. That's not really a statement you want to put on YouTube, is it? I made the decision to go with Kesimpta. The drug is called, okay, it's really, really hard to say. Hold on, we'll have a sip of coffee and we'll figure it out. Ready for this? Ofatumumab. I said it wrong. Again.
Ofatumumab. Ofatumumab.
If anyone can actually say it correctly, please just help. Kesimpta has reduced relapses, further lesions. Studies have shown absolutely brilliant results. That's one of the reasons I wanted to try it. It's going to be a stronger drug than Gilenya for me. So hopefully that will help.